you need to start asking specific questions about what is my life going to be like after treatment. And among them, are any of the medications that I'm taking now, is there anything I'm going to have to worry about physically um, once I'm done with chemo? And it's a very natural question, in retrospect, but when you're in treatment, especially if you're an adolescent or a teenager, your focus is going to be on getting this thing done and getting back to as normal life as possible. And you don't really worry about as many things as you need to worry about, as you're finishing treatment. And so even though the information's out there and it's been out there for quite a while, even though pediatric oncologists are better at knowing they need to prep people for life after chemo, don't assume that that's going to happen, and be prepared to ask very specific questions, to not so you can be a hypochondriac or worry, but just so you can be prepared and then keep it in your mind, but you can move on with life. The main physical issue that I've had to deal with, it's a little bit related to the treatment that I had. Cardiotoxicity is what it's called. And it's not an active problem at the moment, but it's something that has restricted what I can do in terms of physical activity. And it's kind of a looming threat that I have. What it means basically is that some of the chemotherapy that I took, and I took it in very high doses, can affect the heart muscle. It could cause the heart muscle to eventually get brittle or tear, and certain activities like weightlifting or weight-bearing activities can cause the heart to tear. And so I have to watch what I do when I exercise. Even though I'm supposed to exercise and live a healthy lifestyle, I have to make sure I don't do certain things because it could be damaging to my heart. The fatigue factor has just been kind of always like the fly buzzing around my head that it just won't go away, and that really has had a bigger impact in my life than I think I had appreciated until recently. And that's a big bummer because I know that intellectually and kind of like spiritually and otherwise, there are so many things that I could do, but your body has to do it, and you have to have energy to do it, and I don't always seem to have the energy to do what I'd like to do. And I also get upset because I used to, again, say that it was laziness or lack of motivation, or some kind of mental issue, and now I know that that's not the case. I wish I would have known that sooner, because that would have been very helpful for me, for my morale, and for my motivation even, I think. I really can't say that I was able to get back into things socially till a good 5-6 years after treatment, when I started college. Academically, it wasn't too hard to catch up. Socially, it was really, really difficult. You want to keep interacting with people your age, both people that are patients and people that aren't patients, people that don't have a life that's only cancer. And you really need to believe that you will have a life beyond cancer, that won't be surrounded by doctors or centered with treatment once you're done with chemo. You really need to understand that you need to maintain whatever social skills you had before you got into this, because you will have a life well beyond this, and your life well beyond this is very important. My name is Octavio, and I'm a 19-year leukemia survivor.